Good morning from Los Angeles, California. Good afternoon, good evening, wherever you are in the world. Welcome to today's webinar. This is post-COVID-19 plans to provide exceptional care to the people of Los Angeles and the world. I'm Dave Whalen, the CEO of Bioscience LA, a catalyst for life sciences and health innovation in Southern California. I'm your moderator today. Before we dive in, just a few announcements. First, on the right hand of your webinar window is a small question icon. You can click on this at any time to submit a question to our speakers, and then we can respond time permitting. There's also a small icon beneath the question icon where you'll find handouts and support material for all of the organizations who are part of today. You can download those anytime during the next hour. You can also download them throughout the conference this week, as well as return to the recorded webinar afterwards. So without further ado, we'll dive in. Again, post-COVID-19 plans to provide exceptional care to the people of Los Angeles and the world. Just a quick moment. So again, Dave Whalen, CEO of Bioscience LA. We are the innovation catalyst for life sciences innovation here in LA. And we partner with all of the academic institutions, all of the hospitals, as well as startups, growing companies in life sciences across LA, and I'm very excited to have four not just leading hospitals here in Los Angeles, but I would say leading hospitals in the US and the world. And we're going to introduce our panelists in a moment, but just a bit on these hospitals. So Cedars-Sinai, City of Hope, Keck Medicine, USC, UCLA Health, as I said, leaders here in LA, leaders in the US, leaders around the world, all nationally ranked in multiple fields. I've worked personally with Cedars and City of Hope many times over the years, as well as UCLA Health, and getting to know Keck USC. So very excited to be working with these world-class institutions. Again, all ranked. Just something to add that's not on our sheets here from an innovation standpoint, which we'll dig into shortly. Both City of Hope and UCLA are alpha stem cell clinics as part of the larger California Institute for Regenerative Medicine. We might talk a little bit about that. We'll also talk about some of the research specialties throughout these institutions. So I'd like to lead off with Dr. Haitham Hassoun from Cedars-Sinai. Dr. Hassoun, if you could just take a couple of minutes and introduce yourself as well as Cedars.
Thank you, David. Thank you, panelists, Omnia Health organizers, and all of you who've joined today, whether it's the morning, afternoon, or evening. I'm in my office in Los Angeles. I think the best way to introduce myself and the organization right now is it's been a fascinating ride. I joined Cedars-Sinai just over 18 months ago from Johns Hopkins, where I've spent most of my sort of career as an academic vascular surgeon, and then on to really focusing my career in global healthcare, and now as an executive at Cedars-Sinai, building our international program. It's been walking into a global pandemic. There's it's kind of just walking into the fire, if you will. But it's been fascinating. I'm very proud of our hospital. Cedars-Sinai is, if you look at the honor roll, and you were getting into some rankings, David, we're definitely the youngest hospital in our top 29 honor roll hospitals in the United States. We are the only one without a medical school or university attachment. And I believe we're the most dynamic academic medical center today. Our ethos and our origins comes out of a community hospital, actually two of them that merged together. And really, it's about as old as I am, from the early 70s. This hospital that currently exists was brought to Los Angeles in the community. And today, I think, we're leaders in many clinical areas, very well known in our heart and vascular center, which is ranked number 3 in the country by US News, our GI program, orthopedics. There's so many that really shine for us. What I'm most proud of is how we've pivoted during this pandemic with style and grace is the best way I would describe it, and with humility and tolerance for those who you know, many different responses, not only locally, but around the country and the world. But what unifies us is you know, our commitment to take care of the patient safely, both for Los Angeles and the global community. Our international program is a little bit different than like where I came from previously, Johns Hopkins or some of the other big hospitals, because we're in Los Angeles. We've not come down to, like, you know, it's not completely stopped for us. We have many patients who are either traveling through LA or spend time here, and we've had to pivot to take care of them in additionally to the local community. You know, we're going to get into a lot of topics. One of the most fascinating things to me has been, and many of you are aware in your own hospitals, is the transition to virtual care and telehealth. And I'll share some numbers and what it looks like for us. And it's really eye-opening. The last thing I would say is that, you know, I think right now the jury is still out on what's happening. So I've done a few of these webinars, probably one a month since we started this pandemic. And it's very interesting that the dynamic locally and globally is continuously changing. And so I look forward to hearing more from the panelists and to talking more. Thank you.
Perfect. Thank you so much. Now I'd like to introduce Dr. Yuman Fong from City of Hope. Dr. Fong.
Yeah. Good morning, everyone. And again, I'm at the City of Hope, which is a medical center here in one of the suburbs of Los Angeles. So let me introduce myself for a second. I'm the chief of surgery at the City of Hope, and my day job is that I run a very large department, and I perform surgery robotically on the liver and the pancreas, and that's what I've done for the last 35 years. But my lab job is that I design viruses and immune therapies and CAR T cells for human use, and that's why I came to the City of Hope 6 years ago. It really is an amazing center for innovation in cancer care. We only do one thing, which is cancer. And so unlike the other hospitals that are on the line today, who are amazing hospitals that do many different things, all we do at the City of Hope is cancer. And from the liquid tumor standpoint, we were, meaning leukemia and lymphoma, we were one of the first people to go do a transplant, bone marrow transplant. And we have become, over the last 2 decades, the safest place in America to have a bone marrow transplant. And from the solid tumor standpoint, that's every other cancer, meaning, you know, everything from lung and colon. And we have been in Center for Innovation in terms of robotic surgery and minimal invasive surgery. We've done over 13,000 cases in robotic surgery and almost every organ site that you can think of. And so again, that's who we are. These are very interesting times, and that, you know, we've been put into. But cancer and troubles with cancer haven't stopped, even though a pandemic is ongoing. And other forms of health problems and diseases haven't stopped. And that's why joining all my panelists today is really important to try to convince people with disease to go seek the best care. And we all believe that some of the best care available worldwide is here in Los Angeles. So I'm really happy to join all of you on this panel today. David?
Great, thanks so much, Dr. Fong. And actually, I'm so glad you mentioned the concept, whether it's around cancer care or other diseases where there's been so much focus, I think, on COVID-19, kind of from an overwhelming standpoint, both from a clinical as well as the research side, which I see. And so I think it's important for all of us to remember that there's a lot of other things to be focusing on. This is all about balance, and we'll certainly talk a bit more about that. Next up, Dr. Renee Sotelo from Keck Medicine of the University of Southern California, USC.
Well, good morning. Thank you for the invitation. Well, I'm a professor of clinical urology at USC. I'm basically robotic and oncology surgeon, and basically my practice is like 90% robotically. And I'm also the medical director of the international department. Well, Keck Medicine of USC is the University of Southern California Medical Enterprises. Of course, we're located in LA. And basically, we consist of 3 major hospitals. We have over 600 beds and 60 affiliated clinical through Southern California. We also have 2 urology centers that we also co-direct, one in India and one in Brazil. And we're going to talk later about the ranks. Basically, we have 3 of our 9 specialties are ranked, and most important, urology and cardiothoracic and geriatrics and ophthalmology. But basically, urology we did last year, for example, I think over 1,300 robotic cases. We are the #1 in urology robotic cases, maybe in the world. And we have faculty that have pioneered and described many of the robotic techniques. And basically, that's one of our major strengths. But we have also a big program in live donor, in liver donor transplant. And well, I'm very excited to be part of this panel and learn more about the other institutions in LA and how we can join and how we can make together efforts to make LA as a destination for international patients.
Great, thank you so much, Dr. Sotelo. And finally, UCLA Health, we have Tanya Andreadis. Tanya, could you give us a brief introduction about yourself as well as UCLA?
Good morning. Yes, thank you for having me. It's an honor to be here with my fellow panelists. I also am new to LA to some degree. I've been here for 18 months and have really learned so much about it coming from the East Coast in Philadelphia, where I worked previously. There are many, many distinctions, and it makes LA really a destination for healthcare. Just a little bit about UCLA Health first. UCLA Health has 4 hospitals, including a children's hospital and a psychiatric hospital, one in Westwood, that's our flagship hospital, and also one in Santa Monica. We are a very large outpatient organization, huge footprint, over 200 clinics throughout the greater LA geography, all the way north to Ventura and south almost to Irvine. So we have really big outpatient primary care, specialty care, and we're an academic medical center. Part of UCLA Health is the David Geffen School of Medicine. The David Geffen School of Medicine is a very sought after medical school. And we're home to many really wonderful things, actually. One of the things I realized coming to UCLA Health is we really are a very humble organization and have not talked about all the amazing things that have started at UCLA Health. But just to name a few recent things, we are a leader in liver transplant, and I'm really excited about a recent FDA approval where we got our FDA approval for immunotherapy drug for liver cancer. So we're also, like our peers at City of Hope, we're very early in the CAR T movement and have a tremendous strength in CAR T as well. But we can get more into some of the specifics. UCLA Health is a very comprehensive organization and strong in many clinical areas. Thanks again for having me.
Got it. Thank you so much, Tanya. And yeah, your point about UCLA Health being sort of quiet about some of these things, I actually think to some extent that's one sort of commonality that we have here in LA is that we've got some tremendous clinical capabilities across these 4 institutions, and there's also some tremendous research capabilities as well connected to all of them. And you know, we want to make sure that we're spreading the word about all of these, and especially how they connect, not just from the clinical standpoint, but research that connects to you know, to other kind of commercializable technologies coming out of organizations here in LA. So hopefully we'll have a few minutes to talk about that. But want to kick off with sort of the you know, the elephant in the room, if you will, and our subject of the talk, which is sort of how have each of your institutions really been adapting to the pressures, the challenges of COVID-19? How do you make sure people are feeling safe? And as I think we've talked a little bit about, as Dr. Fong mentioned, how do we make sure we're balancing work around something like COVID-19 with all of the other essential work that's required to keep people happy and healthy, and in particular to serve the international population? And so let me kick back to Dr. Asum, and would love to just get your thoughts about how have you guys been responding here?
Thank you, David. So I'll give I'll try to keep it brief in terms of our journey through this. I'd mentioned early that it's changing, and I think one of the things I'm most proud of is our communication throughout this sort of what I would say is a crisis early on, and now has become sort of a new reality of having to deal with. If you take a little bit of a step back, let's just use the United States as an example rather than the whole world. I mean, I think what everyone recognizes is how different the experience is depending on which community you are. So if we take our two largest metropolitan areas, New York and Los Angeles, we've had very different experiences to the COVID-19 pandemic. It doesn't mean both are not significant, being large urban areas, and I think the story is still unraveling. In New York with the surge that was somewhat overwhelming, even our own, we had some of our own physicians go and help some of our colleagues in New York deal with that. We never felt that. We prepared for a surge early on. We established our tent. We re-engineered essentially our whole hospital functions within a matter of days to a couple weeks in March. And it's quite humbling and pretty amazing to see. I think we're the largest hospital in the Western United States. We have 900-bed hospital about. We're at capacity on a daily basis under normal conditions. And so, we obviously had a fair amount of patients who came to us ill with COVID-19 and required the gamut of, just diagnostics and the challenges that brought all the way through the most advanced management of, the failing lungs, such as ECMO and what have you. And, we've done, I think at our peak had about a census of 120 for several weeks patients who were positive. And for Los Angeles, that's been a steady burn, just like it has been in our hospital. Now we're about half of that, but it's not come down, for example, like it is in New York. So, what is that impact on us for the long haul? We may have to be prepared really for, getting to care as part of this new normal. In fact, I was on call for vascular surgery here at our hospital last week, and I was just, it was my first clinical foray since the start of this pandemic. I was quite amazed at how we've come to embrace the new operations around the hospital, keeping our patients safe. But at the same time going about our care, because we were amongst the first voices to remind everyone to take care of themselves beyond just the fear for this COVID-19. Delay in care, whether it's heart, brain, or cancer, is having a detrimental effect. And we want to make sure that people know that they can come to our hospital and get care and get it safely and get it done with the best outcomes. And I feel we're well prepared to do that now. I think the last comments I'll make, I think almost circles back to the beginning. Because we have a lot of global connections, especially with China. I think early on, before the start in March, we were well connected with peers on the supply chain front and have really vetted. And as all of you know, it's become a bit of a problem because there's no guidelines and no, for these sort of pop-up companies who are trying to push, PPE and other types of materials. And I think our group has done a great job of making sure our hospital's prepared. We've never felt a shortage or even that we would have a problem from that aspect. We also were committed to help others, whether it's in the United States or even overseas in China before it came to the United States. With masks and gowns and other materials. So we've been intimately involved in this on a global scale. And I think, that's a critical component I want to mention, that we're all kind of in this together, both our hospitals here in Los Angeles. For those of you who don't know, our presidents have all come together and created communication to the community about the response to COVID-19. And I think it represents sort of the general culture here in the city, which is a sense of, despite us being one of the most multicultural and diverse and tolerant environments in the world, we're in this together, and we're very focused on the community as a whole.
Great, thank you so much. And actually, just you mentioned PPE, and one of the things which I think was really interesting and innovative that Cedars was part of, as the Cedars-Sinai Accelerator teamed up with, I think it was Snapchat early on, and they were leveraging 3D printing technologies and building face masks and things like that. So this really interesting collaborative, innovative partnership, bringing together the accelerator and a technology company here in LA to move things forward. And I think we'll hear some more stories like that today as well. So Dr. Fong, from City of Hope standpoint, how's the hospital been adapting and adjusting?
Yeah. So as I said before, all we do at City of Hope is cancer. So when you think about vulnerable populations, one of the populations we worry the most about are the patients with cancer under treatment with chemotherapy and other therapies that suppress the immune system. So it was really, really important to respond early on and respond in a very proactive way to protect our patients. So starting in the end of February, when it was very clear that this was going to be a worldwide problem and not just a problem in a single area in the world, we actually put into play a number of plans. Beginning of March, we shut down the campus, and I did screening for everybody coming on campus to be sure that it was asymptomatic patients coming on campus. We actually ramped up not only COVID testing, but protective equipment and in many fashions. In fact, we wrote one of the most cited papers on PPE early on. I went to the Annals of Surgery, and as a guideline for how we use PPEs as surgeons and as cancer care folks. And we've written guidelines in colorectal cancer therapy and many other cancer therapies that are out there. Then we did universal testing of all surgical patients. Okay, that was end of March, beginning of April. And then by April 14th, we were able to resume all surgical services. And so far, we've done over 2,000 tests for surgical patients, and only 4 have come back positive. And because we found them before they came to the hospital, we've actually been able to keep all COVID-19 cases out of the hospital. Our main hospital has not seen a single COVID-19 patient because, again, it's a place where there's lots of vulnerable patients. And so making sure it was safe was important. We set up in a different part of the campus because we have 135 acres where we are in terms of our campus. We're able to set up a separate building for those patients that with cancer that we were taking care of that got COVID-19. And so we actually have a separate isolation unit and therapy unit in a whole different part of campus where we're taking care of COVID-19 cancer patients. But in the main hospital, we've been able to keep everybody safe. But I just want to say, I reiterate what Dr. Hassoun was saying. Cancer doesn't stop. And when people always ask me, when are we going to cure cancer? I always say to them, well, we've already done it. That's because stage 1, 2 cancer, we cure almost everyone already. And if we found everybody at stage 1, 2, we've actually had the cure for cancer. My worry now is, given the COVID-19, that patients will delay their diagnosis, delay their treatments, and move into stage 3 and 4, where we're still having troubles, okay, taking care of curing everyone. And that's why it's really important now to figure out how to take great care of patients, but then how to get the word out and get patients to care. And again, my colleagues here, these are 4 of the best medical centers in America and in the world. And we here in California, we've been very proactive in keeping cases down. I spent 30 years at Sloan Kettering, and New York is a different place, okay? And in terms of penetrance of COVID-19. And so right now, not only has Los Angeles always been a great healthcare destination, I think given the landscape of COVID-19, it's even a better destination than ever, simply because I don't think any major city is going to be immune to it. And now, how are we going to get together, make sure we take care of patients very safely? So thanks, David.
Yeah, absolutely. That's terrific. Dr. Sotelo, anything different on your end from the USC standpoint?
Basically, I think all of us have done the very similar things, how to create different flows for all the COVID patients or suspected COVID patients. So PPE, we have worked also with the bioengineering school of USC, working in having different prototypes of masks. And but basically, we have done similar things for international patients. Basically, we try to ask them to do the COVID test 3 days in advance of any patient that's coming for surgery. And we screen for all symptoms before they come. And we try to see if we need to repeat the test when they arrive to LA. But basically similar things, I think, that following the rules, how to be safe and keep our patients and our team and our workers in a safe environment.
Perfect. Thank you so much. Tanya, anything to add from the UCLA Health standpoint?
Yes, so at UCLA Health, much like my peers here, we were, very careful with patients and isolating COVID patients. We were early with testing. We ramped up our lab capabilities really quickly, even to surprise ourselves, honestly. We moved, and we may talk more about this later, from, maybe 500 video visits a month to 60,000 video visits a month. So the ramp up with our telehealth capabilities was really, really incredible. But being a marketing and communications professional, I think one of the things that was most proud of is the communications that were so essential during this time. And we were really, with our leadership and our physician leadership and our executive leadership, very focused on communicating with our staff and our teams internally. We knew that that was really important for people's reassurance. We did multiple emails a day. We also communicated with our patients weekly. We were hearing back from our patients every time we sent a weekly communication, things like, thank you so much for communicating and keeping us up to date. We learned through research that patients really wanted to hear from healthcare and hospital systems more than any other place. And so they were really looking to all of us for, answers and to address their fears. So UCLA Health was, we really put ourselves out there and trying to provide as much information as possible. And it was quite an effort because we launched a chatbot, an AI-driven chatbot, to answer COVID-19 questions specifically. And we had to be, optimizing and changing answers to that bot multiple times a day because of the nature of the information and how quickly it was changing. But we saw up to 500 chats a day, people coming and saying, where do I get tested? Should I get tested? How do I know if I have it? How do I take care of a COVID-19 patient? And our most popular, even I think today, bit of information that led to a deeper page of information was regarding the antibody and serology testing. There was a really big need for information there. So really investing at all levels of the organization and communication was something that we did. And then just to end, we also are now in what we call sort of a reassurance phase of our marketing and communications. Someone mentioned that we are involved in a campaign all together with the largest health systems in Los Angeles called Better Together. The website is bettertogether.health, and UCLA Health and my peers here really came together to say your healthcare should not be on pause just because much of life is on pause, and get back to the doctor, get back to what's taking care of your health. So that's something that I'm really proud of in the working together, and it does really make LA a unique place, the way that we're all able to come together as organizations to support our community. Thank you.
Perfect. Thank you so much. Yeah, and I will say from the sort of innovation research side of things, where I spend a lot of my time watching all of the hospitals, all the research organizations in LA really come together to move forward testing technology. And it's not just technology, it's the logistics around it, which frankly sometimes are more challenging than the actual technical side of the tests. But we're making a lot of progress and finding ways to get everyone tested as quickly as possible and make that more of a more of a piece of the routine here, which is important. And hopefully we can now, we've kind of covered the current situation, really want to dig into what makes LA special and why LA will continue to be a leader in the delivery of healthcare, as well as the research underpinning it. And kind of kick that off by really focusing on what makes LA this ideal medical tourism hub. And just to kick off the conversation a little bit, and then we'll dive into some of our panelists here. I will say, without naming names, we have some incredible weather compared to some of the other let's call them healthcare destinations in the U.S. And I don't want to be shy. We've got amazing weather here in LA, which just permeates everything that we do. But more than that, we've got an amazing network of hospitals, even beyond the 4 that are on here today. We have a tradition of research that is driven by UCLA, USC, Caltech, but also a number of other academic institutions, both private and public. We have hands down the best public school system at all levels, university levels in the country. And then what's really important to me and what I'm working on with the research side of Bioscience LA is the amazing diversity here in Los Angeles, which is a population diversity, it's an industry diversity, but from a standpoint of anything from clinical trials to access to a patient population to even just connections to your local culture, everything from from food to fashion to understanding, we have it here in LA. So the entire world already lives here in LA. Which is why we're so excited to welcome the entire world here. And with that, going to mix up the order a little bit just to keep everyone on their toes. Dr. Fong, would love to get your thoughts on what makes LA the ideal medical tourism hub.
Listen, I've never quite understood why LA hasn't grown as much as other places, and I think now is a great time to grow it. Okay, so let me just echo what David was just saying. We have 292 sunny days in California, in Southern California every year, okay? 292 days. The average temperature year-round is 75 degrees Fahrenheit and 24 degrees Celsius. And so from a weather standpoint, spectacular. Access is also huge. You can see on the map here, 5 major airports that you could fly into. And so before COVID, and I'm sure after COVID, there are direct flights from almost every major city in the world, okay? Not just the country, but the world. And it is truly multilingual and multicultural. So no matter what culture folks are coming from for healthcare or to study here in Los Angeles, there is a familiarity immediately, okay? And it's not going to a strange place in America where, again, finding a cultural fit is a problem. But I think the best reason for us being a great medical destination is epitomized by these 4 medical centers that are talking together today, okay? Competition makes us all good, okay? And there are so many great medical destinations in Los Angeles. There are over 80 hospitals, 14 hospital systems, 6 major academic centers. My personal academic affiliation is Caltech. I'm actually in the Department of Medical Engineering at Caltech. And therefore, again, there are a lot of colleges keeping us on our toes in terms of innovation. And so again, just a great collection of intellectuals focused on healthcare and focus on many health problems, and many young people working on innovation of the next generation therapies. So just a great place to go to, David. And so I totally agree with you.
Perfect. Dr. Sotelo, would love your thoughts on LA.
Well, I agree with Dr. Fong. The same question: why we're not stronger as a destination? And I think that's the big question is going to be after this. If we really can keep working in this consortium to make it LA as a destination, I think we have to work more close with the mayor office to see how we can get more support. It's obviously a destination, but it's California is the destination, but we haven't get as many patients as other states. I think all the institutions have been marketing independently to outside, not only from California, I think from other states also. And now that we see that other countries are big destination for medical tourists, not only US, and then we see there's more competition, Germany, also UK, also some centers in Korea, some centers in Japan. And then now I think that we get to the point that we need to start working more together. And we need to understand that is California the destinations. It's not only weather, it's not only that we have multicultural, many languages. It's the 3rd airport busiest of 4 in the world. It's also that we have one of the amazing centers, amazing doctors, incredible technology, research, and now also we need to make the people aware that we have all that in California.
Yeah, absolutely. I think, you know, it's important to say that we have whatever you need here in LA from a healthcare standpoint to everything that supports it, everything wrapped around it. So there's a complete package here, which let's do a better job of spreading the word. So speaking of spreading the word, Tanya, from a marketing standpoint in particular, how do we focus on growing what we have here in LA from telling the story?
I guess we can't say enough about the weather, clearly, and sounds like some of us have lived in other places, but it really does. It's a beautiful place to live. It's a beautiful place to be. You know, just picking on Philadelphia because I came from there, it struck me that, you know, we would have people overseas flying right over California to go to a colder, not as quite beautiful place. With, you know, right over all the great capabilities here from research to clinical care and beyond. So I think we do have to figure out how to get that word out, and coming together and working together is a really good first step. The other thing I think that's really different about California is there's a true genuine focus on health. This is part of the culture here. It's part of the people. Individual health, feeling good. It's important to the doctors and providers that their patients feel good and are focused on their health. Time is spent with patients here in a way that's like really focused on how can I make you as an individual feel better and live your best life. And, you know, in other places you find them really sophisticated at treating sickness or curing something at hand. But here in LA, we can do that and really focus on health, well-being, quality of life. And I think that's really remarkable. So we really do have to get together and tell this story. There's no reason why people wouldn't come here. We have beautiful hotels, amazing food, beautiful weather, and absolutely stellar healthcare organizations.
Great, thank you. And Dr. Asum, I'm going to assume that you love the weather here as well. So we're gonna jump over you on this one. I want to actually dig into a little deeper question here about clinical differentiation. And you know, once we get people here, what's really important for them to understand about the amazing clinical expertise. And so you know, starting from your end, what are your thoughts here?
Well, I mean, it's good because I think I can merge the last question. I wasn't going to talk about sunshine and rainbows and pretty things. I was actually going to talk about U.S. healthcare first before. And since much of our audience is a global one, you know, I spent the past 10 years of my life has been focused on healthcare outside the United States, and how previously at Johns Hopkins and now at Cedars, we're connecting and developing collaborations and long-term sustainable partnerships. And many of you know about the ones that I'm talking about. And so for me, you know, I think, you know, you got to think about why U.S. healthcare first, and then talk about LA and talk about our individual hospitals, because I do think we are on this panel representative of the sort of the finest of what U.S. healthcare has to offer, being a major metropolitan city and sort of self-selected here, if you will. You know, I've had the opportunity to work with over 40 health systems around the world, and you know, and operated in many places. And I think still today, people recognize that when you come to our top hospitals, you're going to get the best chance at life, and we have the ultimate quality outcomes. And we also do that in a very compassionate, with a patient experience first and foremost as a focus. You know, we must admit our faults or our challenges. You know, healthcare here is costly, not only as a system, but for an individual patient. And many of our patients are coming, they're self-pay, and they come here. And I think we are obliged and very have already started between these institutions a collaboration for more transparency, and so that we can help patients who are coming from outside the United States. You know, they don't need to go shopping around. If we can pull a campaign to transparency and sort of our pricing models, and remember that many of them are not coming with insurance, some are, and there are no contracted necessarily rates. So I mean, I bring that up as well. You know, at our hospital, you know, we really take care of all kinds of patients. We have the best heart transplant program in the world, and if that's not representative of a complex level of care, we do the most. We're very proud of that, but that's the tip of an iceberg of taking care of heart failure as an example. And it's the same if you look at, you know, our orthopedic, our neuro population, our cancer population. I do think that you have to look at this as sort of really treating a population and try to, you know, view them on the continuity of care. So the word that I use nowadays most for our international programming is we're very interested in the hybrid approach to taking care of our international patients. And that means it's not just when you're here in our grip in our hospital at Cedars-Sinai or one of our clinics, but it's also when you go back home, and it also involves the whole continuum, the payer, those who are helping with the referral pipeline. We've got to get really use our virtual visits and our telehealth platforms to connect and to take care of the patient. If you can't treat heart failure in a continuum, you're not going to do a good job of just doing transplants and transactional care. So that's our ethos here, and that's what drives us, and we'll continue to try to improve and be the best.
Fabulous, and I'm so glad you mentioned both the sort of that the continuum of care and telehealth, which I think, you know, we're seeing, especially here in the U.S. I would say that, you know, we've been in some ways the leader of telehealth technology, and I'm going to say, you know, maybe lagging behind a little bit in the implementation of telehealth, and we've certainly seen that really blossom just over the past few months as you know, based on circumstances. But we are finally truly here in the U.S. in this this world of telemedicine, telehealth, and I think in particular for international patients being able to understand sort of not just what happens when they're here in LA, but what's happening on both sides of that, and kind of the access and care before they're here in Los Angeles and after. It's particularly important. Dr. Sotelo, would love your thoughts on kind of that clinical differentiation, and also, you know, you mentioned kind of practice areas internationally as well, and so how do those things fit together with your work here in Los Angeles?
I want to pick some of the comment that Dr. Hassoun was making it about the telemedicine and the opportunity, I think, for working together, how to overcome all the difficulties for the international regulations. For example, I'm original from Venezuela, and I have license in Venezuela to practice in Colombia and Mexico. And I know very well all these health systems in South America. And there's some specific regulation with some of these countries, and also in worldwide, that we need to work together, how to get all these disclaimers and all these legal issues, how we can do better and more frequently these international consultation, because for these patients traveling to US only for a second opinion or for a really expert, sometimes they don't need to come. They can have a perfect video conference, and then we can decide which ones need to come for services. And that's very important. Consider also that, as Hassoun was mentioning, most of these patients are cash. And it's a way to see more patients and to give more services without the need that they need to come. I think that would be a good thing to start in this consortium, how we can work together to get a better telemedicine for international patients platforms.
Perfect, thank you. Dr. Fong, anything to add from the City of Hope standpoint? Oh, I think you're muted.
Yes, so again, of the groups that are here on the call today, meaning the representative of international medicine, I think we are the groups that have been most proactive in using telemedicine than any other group in the hospitals. And now telemedicine really comes in two flavors. One is taking care of patients, so we can do remote consultation, and then remote follow-up to link not only with the patient, but with their doctors back home, so that we can actually help make sure the plans that have been organized for care before, care afterwards, for cancer or for vascular disease or for whatever disease is taken care of. But the second part of remote medicine is really education. Okay, so I am the head of academic international medicine for City of Hope. And in that role, I've actually I joined with the other three organizations. I've actually done international medicine, both in place and remotely with Cedars, in doing many educational projects in China and elsewhere in the world, and with UCLA and with USC. So I know they're all set up to go, okay? The telemedicine capability, not only for patient care, but for medical education has been huge. But I want to once again emphasize that if someone comes to Los Angeles for healthcare, they can actually go to multiple medical centers, not to get opinions, okay? And this is not some place where you go and there's just one trick in the show in certain cities. And so between Renee Sotelo's program and our program, we probably have some of the finest robotic surgeons in the world, okay? If somebody actually is interested in robotic surgery, there you go. You can actually go to 2 different institutions and get really good opinions. UCLA has some of the best liver transplant in the whole world, and Dr. Fasoon's absolutely right. Vascular, thoracic, and cardiac surgery and transplant at Cedars is spectacular. So again, just an amazing healthcare destination, Los Angeles. And I just think that if you're looking for an innovation that exists in the world for healthcare, you can probably find it here in Los Angeles. And so, and again, I've never quite understood why New York or Baltimore or Rochester, Minnesota. I think that the choices are much bigger here, and all of the options are available, and the expertise is here.
Perfect, perfect. That's terrific. And yeah, I think we're going to work together to spread the message more broadly. And we got a couple follow-ups about that. I want to talk a bit about innovation in a moment if we have time. But we've actually got an interesting question, which I think ties into some of what everyone was just saying around both kind of that pre-post, the telemedicine, and what Dr. Sotelo mentioned about leveraging telemedicine for, say, second opinions or things like that. And so we have a question that's, given that international travel is still grounded for the moment and potentially for a bit longer, how are the hospitals here in LA handling situations if international patients are looking for, say, urgent care or specialty treatment that might only be offered here in LA? And I'll throw that out to the panel and whoever wants to address that.
Well, I'll jump to, I suppose. I mean, I think the first answer is we're doing it responsibly. You know, I think it's Tanya mentioned about the high volume of cases have gone to virtual visits, and we're the same here locally. It's really amazing. I don't know, I don't have a visual, but if you could see this graph, this is going to tell a story that's amazing. The blue over here is before COVID, the week, and each bar is a week. Blue is basically patients in office visits. The orange is telephone, and the gray at the bottom is virtual visits. Now, it tells a fascinating story because the jury is not out yet. And the reason why I'm showing this is because I couldn't even describe it, but we pivoted in a matter of a week or 2 weeks to transforming healthcare to a virtual enterprise. But what's been interesting, we've now been open for, I mean, I don't like using that word, we've been open all the time, but we focused more on these time-sensitive care. And as we've done that the past month or so, getting back to sort of somewhat of a normality of taking care of patients, you see that those in-office visits are coming back, and those bars are in 15,000, 10,000 visits in our network. It's a high volume. So we don't know where it's going to end. You know, I know there's a big push that telemedicine is going to completely overtake healthcare. I'm not sure if that's necessarily true, but we do assume that some piece of the paradigm is going to be there. And I think what we got to understand is what do patients want? What do people want? And it's not just doing it, but it's when is it right to do it, and when is it safe to do it? And we're learning on the fly. And I'll circle back in the end. For international, this is a big question. I mean, still legally, we don't want to put our physicians at risk, or for that matter, the patients, wherever they are. We need to be responsible. So we still stick to the, we're happy. We do it. We prefer to do it more of a B2B approach. internationally, where we connect with health systems or governments who want to do this, taking care of patients sort of as part of the continuum, rather than an individual reaching out to us and just plugging them in with the doctor and pay a fee. When we do want to help our patients though, so we try to have their physicians with them and make it more of a physician to physician consult. I think many of you are doing that. I'd be interested to hear from others from the panel what their tangible experience is, but that's still where we are despite the pandemic. We need to be somewhat responsible with our approach.
Sure. Anyone else want to weigh in there? I love this conversation.
I would agree, in terms of our video visit and virtual visit capabilities being a way to access care, that is a great first step. I think we can have, facilitate things like second opinions or even telegenetics, for example. UCLA Health has a strong telegenetics program. And the other thing that I think UCLA has been doing, and I'm curious if our peers have, is just being a support to physicians that are local and on the ground. So where other physicians that are local to that community can be advised by the UCLA Health expert in a particular area, and then the healthcare teams really can work together when there are travel restrictions that are preventing them from coming in person.
I feel that this is something that's going to stay, and then not only telemedicine is going to be also, of course, teleradiology, telepathology, and we're going to review x-rays. They're going to upload it and somebody here is going to review it. Same thing is going to go with the video microscope. It's not going to be perfect, but it's going to be improving. And also these platforms allow us to have more than one at the same time. It means that we can have the local physician, we can have a translator, and we can have family in different places of the world at the same time with the consultation. And then we can have 4 or 5 people jumping like a Zoom and with a HIPAA compliance environment, and we're going to have more than that. And it's a unique opportunity that family always around the world want to see exactly when his father or his mom is going for consultation. They're going to jump in the consultation. We're going to have translation at the same time, and we're going to have a local physician at the same time also interacting. And I think that, of course, when it's safe, they're going to start traveling back. And there are some countries that already have opened. But I think, of course, being safe for the patient, being safe for the team, and is a priority. But it's going to happen. And I feel that maybe domestically, there are going to come some of the regulations back. But internationally, I think this is going to keep open. And we need to work together to get any experience that we can share, how we can get all these disclosures and how we can make it happen to make it more feasible and more easy to do it for everyone.
So over the 35 years of my career, about a third of my patients have come from somewhere else in the world for a surgery with me. And so working with their doctors back home is a very common thing. But that's actually the experience in most places. The reason there are 3 surgeons on this call right now is because international medicine generally is run by surgeons, because flying somewhere for surgical expertise is actually what folks want. Most medicines are available worldwide, and if you actually prescribe the right medicine with the right chemotherapist or right pulmonary doctor or right vascular doctor, you're going to get the medical care pretty well back home. And so again, I think all these centers are very well set up to go work with your doctors and your good doctors back home to take good care of you. Flying to America now for a surgery, it depends on where in the world you are, okay? It is a problem from a visa standpoint from certain parts of the world, but not as much as other places that are putting their visitors into their countries on a 14-day quarantine. In America currently, there is no 14-day quarantine. We will test you before surgery to keep you safe and keep everybody else in the hospital safe. But if you can get a visa and come here, we can take care of you. And so that's very different than many parts of the world. If you want to go fly to New Zealand and Australia for care, you're now going to be in a 14-day quarantine as soon as you arrive, okay? And so I think that that's also going to change in time in terms of the visas, and I'm hoping it's going to be for the better as we come to understand the COVID-19 better and take care of patients better. And obviously, all of us are very also hopeful that there will be some therapy or vaccine that will be effective for COVID-19 that will change everything back to near normal. But I think telemedicine has always been present for international medicine, and our ability, all of these centers, to work with your doctors back home to take good care of you, to get you on the right chemotherapy for cancer or drugs for vascular disease or heart disease or other benign diseases. We can certainly do that. And remote consultation, I think we're all set up to go do that. So again, it's right now still stuck at the visa stage, and it depends on the country you're coming from.
I feel that another point that Tanya was mentioning about how to tell this story, it's about doing more telemedicine for education. That Fong was mentioning. It's critical because people will see in the world exactly what we can do and what we can teach. And having all these universities affiliation, I think, is a huge thing that we need to continue doing more education using these platforms also.
Yeah, absolutely. And just kind of on a few points that were just made in terms of education, in terms of collaboration, in terms of reaching a diverse audience around the world. I think that all of the institutions here in Los Angeles they're not only prepared for that, but they're leading the way in developing technologies. And I look at both coming out of the academic world here, and then even I mentioned the Cedars-Sinai Accelerator, which I would say between some of the work done there as well as with startups here in LA, LA is hands down the leader in leveraging sort of AR and VR technologies for healthcare, and sort of bringing, as Dr. Sotelo said, you can have a virtual environment with a physician at home, and not just the patient, but family members. We can bring people together in immersive ways. We can help educate them and help them understand what this journey looks like. And I think we will continue to lead the way with that, which is so exciting. So we're wrapping up for the end here, and I would love, we've been talking about kind of telling the story and making sure the world understands really what's going on here in LA. And so would love just very quickly, 30 seconds or so per person, what's really the one key message you want to share with the world? What do you want the world to know about what's going on here in Los Angeles from a healthcare standpoint? Dr. Hassoum, we'll start with you.
I'll keep it brief. You mentioned the accelerator. We have a lot of technology-driven tools, but I actually would answer this question with empathy. I basically would say I'm most proud of our empathy, care, and compassion. I think people come to Cedars-Sinai, and I think it's a microcosm of LA as a whole. Our culture is we listen, we care, and if you look at our patient experience scores, which are fantastic, that's what they're looking. It's not the facilities or tools they're after. They're after people that care about them, and of course our quality outcomes, which are second to none, drive that as well.
Yeah, from my standpoint, as I look at all of the innovations that have happened in the last decade for cancer, it's amazing how fast we are moving. Diseases that are stage 4 now are potentially curable. But for Los Angeles, I think it's the multicultural, okay? And I think we are all so used to taking care of patients from every culture and every background. And so the same kind of empathy that Dr. Sun was talking about, it is empathy not only built on human goodness, but also built on our experience in taking care of patients from many different backgrounds, and making sure communications is correct, and family education is correct, and then recovery and return to normal life is correct from the cultural standpoint. So again, I think that's going to be important too.
Thank you. Dr. Sotelo?
Well, I think that we have to work together to tell this story. It's incredible that we see the sickest patient in the nation, and maybe nobody knows. And then if we do the most complex cases, of course, we will do the simple one. And I think that we have to work together to tell this story. And people need to know more that we are the destination.
Okay. Tanya?
I would say the one thing that stands out here, again, is culture. It's a culture of health. It's a culture of life, of optimism. It really does make LA a very unique place to live and to get healthcare. And, the patient experience really, truly is a focus. It's not something that we just say. It blends in with that culture of making sure that people are happy and healthy. So I would say that's really, really what makes Los Angeles unique in the healthcare space.
Great, thank you so much. And I want to, we're wrapping up here. I want to thank everyone on the line from around the world. I think we have a few hundred people on, which is terrific. But on behalf of Cedars, Keck Medicine at USC, City of Hope, UCLA Health, thank you everyone here on the panel with me. This has been a lot of fun. I know we can keep the conversation going, and so please feel free to, when you click out of this, there's a session rating. Feel free to reach out to any of us. I'm happy to. I'm taking some meetings on the Omnia platform this week. We're all reachable via via email. So reach out to us on the platform, and we'd all love to follow up and share more. And we're looking forward to seeing everyone here in Los Angeles sometime soon. So if you haven't heard, the weather is great here, and so is the healthcare. So please, please reach out. Thank you all.
Thanks, David.
Bye.
Bye, everybody.
Guys.
Be safe. Bye.